Good afternoon and welcome to United TV and Bariatric Friday. We are going to be with Dr. Erkan for today's session, and we are going to dive deep into the truth, tools, and tips that makes the bariatric journey safer, stronger, and more successful. So, in today's session, we'll be able to discuss multivitamin issues and also smoking and alcohol after the surgery and before the surgery, and pretty much pre and post-op impact of these. So we are going to welcome Dr. Irgau. Dr. Irgau, how are you doing?
I'm doing great, Kemal. Thank you for having me.
It's good to see you. And so I kind of combined these three topics. We had done it, I believe, once before. And I think with this one, we are still about like 14 different topics that 14 different segments that we discuss. A bariatric surgery journey, and because it's a complex issue, and some of them we spend a little bit more time, and some we don't. So, and multivitamin use after surgery is one of the crucial part of the surgery, post-surgery, and especially with gastric bypass and duodenum switch, the DS. And these do have impact on the digestive system, so therefore we are going to be even more careful. So I want to start with my first question and ask you, what are the most important vitamins, minerals that we need to pay special attention to?
So there are several of them. Perhaps one of the most prominent is vitamin B12. And the absorption of B12 is affected after bariatric surgery because the absorption of B12 requires substances that are primarily found in the stomach. And as you know, the stomach in bariatric surgery is prime target for the surgery. It's affected by the surgery. It's either made a lot smaller, like in gastric bypass, or it is a big part of it is removed and it's reshaped, like after sleeve gastrectomy or the duodenal switch. And there are two substances. One is called intrinsic factor, and of course, the acid environment of the stomach that are critically important for the absorption of B12. Therefore, with the fact that these two factors are not normally present, then the ability of the body to absorb B12 is decreased, and therefore we are in danger of becoming B12 deficient. Another important one is iron, which is a mineral. And this is particularly relevant in women of reproductive age because they do lose iron on a monthly basis because of their menstrual cycle. And the absorption of iron is decreased after bariatric surgery, but also the availability of iron is decreased because we're eating less, and therefore the source itself is decreased. So iron deficiency is also something that can happen very commonly. Another big one is calcium and vitamin D. And these are very, very important substances for bone health. And their absorption is especially affected because of the bypass of the duodenum, which is that early part of the small intestine, and that happens after gastric bypass. Folic acid or folate is another one, and that is very important to keep our blood level up, to prevent anemia, but also it's very critical for cell function. Another one that we don't talk often, but is actually very, very important, is vitamin B1 or thiamine. And this is important because it can become deficient in several situations after bariatric surgery, particularly if there are complications that lead to vomiting. In this particular vitamin, its lack, its deficiency can lead to serious neurological problems. So it's very important. And of course, there are the fat-soluble vitamins like vitamin A, vitamin E, vitamin K, and these are particularly vulnerable to deficiency, particularly after procedures that require rerouting of the intestine, like gastric bypass or the duodenal switch.
So, like something like B12, everyone should be looking into their B12 level and should be using iron. As you mentioned, reproductive age is important, but those who may have chronic anemia and related issues, they should be taking the
Absolutely.
calcium and vitamin D together because it's going to increase the absorption of it. It's important for everyone, not just for people with surgery, right? So
Absolutely, absolutely. The people for surgery are much more affected because, first of all, they're not eating a lot, good thing. But on the other hand, if you're not eating a lot, your source for vitamins and minerals shrinks, right? But more importantly, your ability to absorb the small quantities of vitamins or minerals is also decreased because of the changes that bariatric surgery had made. So people with after bariatric surgery are definitely particularly more vulnerable to deficiencies.
So in a different way, so my point is, and our point is, we want to make sure that this is not just for bariatric patients or post-bariatric, but everyone should be looking into these, even if you may be taking, your food intake may be a lot, but if you're not eating the right things, number one, and if you're not eating fresh enough, which is almost impossible these days, you are going to have struggles with these, and therefore you really need to pay attention to those. And this is, again, it should be part of like the daily discipline. You shouldn't be taking some vitamin just because you're not feeling so great. So since you and I, we established that thing in the beginning, maybe, I don't know, it's more than 7-8 years now that I'm on my daily vitamins.
Yes.
And, they're in the weekly boxes. We know what's going to happen for the next 7 days. So first thing in the morning, I take them, and that's about it. So it's not really complicated unless we want to make it complicated.
And you do the same when you're traveling as well, right? You have
the
same
so right now
kit.
I have a 2 weeks box,
Yeah.
and then that's already filled. And that way I don't have to worry about taking so many different bottles.
Good for you.
So those types of organized approach would help and make things much easier. Now, how soon after the surgery should the patient start the multivitamin intake?
So they should start it obviously within a realistic time frame. There clearly is not urgency to start them immediately, right? And I say this because sometimes taking medications like vitamins, that may be large tablets, may be a challenge for people who are just fresh after surgery, because their ability to swallow, their ability to intake by mouth is limited, and it's different from before the surgery. So it could be within a few days or within a few weeks, it's still okay. But the key thing that I tell patients, Kemal, is that I don't want them to struggle to take vitamins and then develop nausea, vomiting, which may then affect their ability to stay hydrated, right? The priority in the first 2 weeks, in the first 4 weeks after bariatric surgery is hydration. And people have a hard time taking enough fluids, enough water at that time. So we don't want that to be interfered with in order to start vitamins quickly. So if they can start them, within days, that's fine. But sometimes, patients would have to wait a few weeks before they start them. And then in terms of what type, whether it should be tablets, whether it should be chewable, whether it should be liquid, particularly at the beginning, chewable or liquid vitamins may be much better tolerated earlier on, and that is absolutely fine as well.
And one of the really important thing is getting the blood work in some frequency. And for best monitoring, what would that be? How often they should do their blood work?
So the way to look at it is that the changes that bariatric surgery affects on people are permanent changes. In other words, the intestine that has been rerouted after gastric bypass, it remains rerouted, which means the early intestine is not available for absorption for the rest of their life. So from our point of view in our practice, checking the vitamin levels on a yearly basis should be for life. Now, that can be done by us or at the primary care level. It's okay, but it's important for patients, particularly in this day and age where patients are changing primary care doctors so frequently, for them to volunteer the fact that they've had gastric bypass, they've had the sleeve gastrectomy, and that they could be at risk for vitamin deficiency. And therefore, this checking of vitamin levels should happen with the rest of their blood work on a yearly basis. Earlier on, after surgery, in our practice, we actually check it every 6 months. And then once they are a year, 2 years out, then we check it once a year.
All right. And now, if you can summarize the risk of the vitamin again, just so that if they don't take it, what happens?
So, well, the way to look at this is this. You're doing bariatric surgery to get rid of a disease. The last thing you want is to inherit another disease, right? You don't want to exchange obesity for malnutrition, right? And malnutrition can occur with different consequences if you're not compliant with vitamin and mineral intake after bariatric surgery.
Right.
So this is an important practice after bariatric surgery, the intake of vitamins. What are the consequences? Well, you could have something called anemia, which is low blood level. If you're not taking enough iron, if you're not taking enough B12, if you're not taking enough folate. And with anemia, you could have lack of energy, you could become weak. And that not only is going to affect your whole quality of life, but you may not be able to exercise enough for you to stay healthy as well, right? Mm-hmm. And then if the anemia is really severe, you could have situations in which you pass out or you have dizziness as well, right? So anemia, and as I said, the ones that are particularly vulnerable for anemia are women of reproductive age, just because they are losing blood on a monthly basis with their menstrual cycle, and therefore they are at higher risk if their iron level is low, if their B12 or folate levels are low. Now, another important one is bone loss from vitamin D or calcium, and that can lead to osteoporosis or other situations where the bones become so weak that they can crack at the lowest stress, right? So you have a little fall that you should be able to tolerate without any problem, and you break a bone,
and
right?
Women are at
higher risk for that. So these are very, very important vitamins for the bone. And then another important one is neurological problems. Kemal, people don't understand that sometimes if you don't have enough B12, if you don't have enough B1, you can have very serious neurological problems. Like there is, for instance, something called Wernicke's encephalopathy, which is an acute neurological problem, marked by disorientation, confusion, maybe loss of balance, that is particularly particularly instigated with the deficiency of B1 or thiamine. And it can be irreversible. So it is very important to stay, current with vitamins. People need to understand that there are some serious risks of not being compliant with vitamin intake, particularly after malabsorptive procedures like the gastric bypass or the duodenal switch.
Absolutely. Now, we are going to go to our second topic, subtopic for today. That's going to be the smoking before and after surgery. So we know that smoking has well-documented negative effect on wound healing, increasing risk of surgical complications, including leaks and infections. And there are so many other issues that comes with smoking, and this is pre and post surgery. There are so many different level of risk. So why is it important for patients to stop smoking before bariatric surgery, and what's the recommendation for them to stop smoking if they are a current smoker?
Well, smoking really increases the complication rate of the surgery. It's as simple as that, right? We want the surgery to go smoothly. We want the recovery to go smoothly. It's critically important, right? And smoking interferes with that, right? So as you correctly said, smoking interferes with the ability of the body to heal, right? So you can have leaks and infections. Healing, people think that the surgeon's sutures are making us heal, right? Actually, the surgeon's sutures just put the tissue, approximate the tissue together, right, so that the healing occurs through nature. The body itself does the healing, right? It's not the sutures that we place. If it was just our sutures, when it
starts, actually.
That's right. So the sutures will place the tissues in close proximity, right? But the attachment of the tissues together so that healing occurs is a natural process, right? And that natural process is interfered with if the person is smoking, which means that any connections that we've made, any portions of the intestine that was divided will be at risk of not healing and therefore serious consequences afterwards. So smoking has those potential risks associated with it. There are problems with anesthesia, right? Your ability to recover from anesthesia, your ability to get rid of the breathing tube after anesthesia can be affected. Your ability to expand your lungs properly after anesthesia can be affected, and therefore you're at risk for pneumonia. Your ability to develop blood clots can increase if you are a smoker. So there are a host of reasons of why smoking must be stopped before bariatric surgery. And because bariatric surgery is never an emergency surgery, bariatric surgeons really took a stand on this and said, we do not want to encourage a behavior that can be modified that to continue before surgery and affect the outcome of the surgery. So most bariatric programs, including ours, actually require patients to stop smoking 6 to 8 weeks prior to surgery for that reason.
Yep. And what are the risks of returning to smoking after the surgery? Like once everything is healed, that's fine, but now 3-4 months later,
Yeah.
they go
Clearly,
back.
we're here focused on the implications of surgery on bariatric surgery, right? But there are 100 other reasons why smoking is a bad idea for a person's health, right? But just focusing on bariatric surgery, for instance, patients who have had gastric bypass can develop ulcers, particularly at the connection between the stomach and the intestine. And ulcers are bad news, Kemal. First of all, they are very painful. The pain from ulcers is just something that doesn't let you go. You cannot sleep, you cannot eat. It is really ruins your quality of life, okay? And then the ulcers themselves that usually heal with medication will not heal if that person continues to smoke. And then there is another part to this story. Ulcers can be complicated by perforation. In other words, the ulcer can burst and let all the intestinal contents into the abdomen, creating something called peritonitis that can lead to very serious problems. Or, God forbid, the ulcer can lead to life-threatening bleeding. So a patient with an ulcer that bleeds can present to the emergency room with massive bleeding, throwing up bleeding, essentially, right? And those can be life-threatening. So because smoking is associated with that, it's very important that patients do not actually take on smoking again. Another problem is, for instance, heartburn. Heartburn gets actually a lot worse if a person is a smoker. And with the sleeve gastrectomy, heartburn is a potential consequence in some patients, and therefore smoking is going to make it worse. And of course, there are other pulmonary problems that can occur afterwards as well.
Sure. And, one of the things that we also know, the smoking does increase the risk of sleep apnea or severity of sleep apnea. And then that's one of the things that we try to take, by having the CPAP or APAP machine, we are trying to actually control that situation. But if they keep smoking, other than, digestive issues, there will be, as you said, pulmonary issues.
Absolutely.
It's just overall, it's not worth even trying. So now, lastly, we are going to discuss the alcohol use after surgery. Well, even before the surgery, we want people to stop smoking and drinking alcohol. On the alcohol, the issues a little bit different. One is like smoking doesn't have much to do with the extra calories, but alcohol comes with so much, way too much unnecessary calories. So, and our goal is to lose weight, and then we will be sabotaging our own process. Now, after the surgery, the digestive system's ability to process alcohol is altered, and smaller stomach, faster gastric emptying, less first pass metabolism. These are all different elements that we need to kind of consider. So from the surgical point, how does bariatric surgery change how the body handles alcohol, and what consequences does the patient have?
The short answer is that the alcohol that enters your mouth enters the bloodstream, the systemic circulation, a lot more quickly after bariatric surgery. And that is directly related to the fact that the gastrointestinal tract has been altered with bariatric surgery. As you mentioned, the stomach is smaller now, right? And also, very often with procedures like gastric bypass or the duodenal switch, there is rerouting of the intestine, which will allow for the alcohol to get into the bloodstream a lot more quickly. So what happens with that? Well, a very small amount of alcohol that prior to bariatric surgery a person was able to tolerate without any problem, now that can enter the bloodstream a lot more quickly. Its effect is more intense and it stays in the bloodstream a lot longer, right? What does that mean? Well, the person will become intoxicated a lot more quickly. The person will stay intoxicated a lot longer, right? Which means that a small amount of alcohol that you thought would have no consequences now after bariatric surgery, that same amount of alcohol may be above the drinking and driving limit. So you could lose your license essentially for a tiny bit of alcohol because the alcohol is entering the bloodstream and staying in the bloodstream a lot more quickly. It impairs judgment, right? If your judgment is impaired and you've had bariatric surgery, it means you're going to forget all the rules you've been told about what to eat, how to eat, and how to live, right? So you could put yourself in a lot more danger, essentially. And then there are far serious consequences, Kemal, and that is the fact that you can overburden the liver with alcohol a lot more quickly and with a lot less alcohol now, creating a situation where you could damage the liver. You could go into a liver failure, essentially, if you continue drinking. So alcohol has some serious changes in the way it's handled in the body after bariatric surgery, and patients who had bariatric surgery need to be very mindful of that, meaning that now they cannot drink the same level that they did before. A very small amount of alcohol will have a much, much more serious effect on them.
So that kind of answer my next question in terms of if there's any safe zone or if there's any guidelines. But the problem is what we are saying here is you go through a surgery and prior to that surgery, a lot of things that patient has to go through. And let's just put it in perspective, someone with 385 pounds weight. Our goal is to bring that patient down to 200 pounds maybe, right? So 185 pounds needs to go. That's half of his or her body, right? So this is not going to be just done with surgery. So this is going to be done by so many other things that patient either needs to help with the complications or needs to help with certain ways of not sabotaging the process. And alcohol definitely sabotages the process of losing weight. And it does create a lot of other issues, as you mentioned, with even as simple as someone can be pulled over. And,
yeah, certainly.
But from our point, from the bariatric standpoint, the calories is just not even, okay to take that risk. And but if they have to, we are telling them maybe 6 months.
That is correct. So yeah,
so little, like not more than 4 ounces, right?
Yes. So half of what would be a normal kind of dose would be acceptable. Again, in our practice, we ask people not to start any alcohol for at least 6 months after surgery for a number of reasons. But if they have to, after 6 months, that will be fine. But essentially, the critical part here is that it has to be small amount and it has to be infrequent. Those are very important things. But not only because of the damages that I mentioned, but also because of the issue of weight regain that alcohol can bring. Because alcohol, at the end of the day, chemically, alcohol is sugar. It's just sugar. pure sugar that's going in without any nutritional value, and it's sabotaging all the efforts you've made to try to lose weight, essentially. So there are very important reasons for avoiding alcohol.
My last question for today, Dr. Erkan, is there is the addiction issue with patients who are going through big changes, and this can be in many different disease issues. So some finds, someone who's dealing with cancer may go into addiction. Someone who has other troubles, they can go into depressions and therefore addiction. So, but in here there is an addiction transfer issue potentially in the context of bariatric surgery and alcohol. What is the addiction transfer?
So essentially, the term really refers to the fact that a person is exchanging one compulsive behavior for another, right? So, for instance, if the person was struggling with controlling their food intake, either because emotionally there was some attachment with food providing some type of relief, or stress, right? So that search for a pleasant feeling when you're feeling down for one reason or another cannot be repeated after surgery because they cannot eat more than a certain amount, right? So food is out of reach in terms of something that they can eat forever, the whole day, to accommodate for that compulsive need, right? Well, they can switch that to something else that can give them the same type of high, which would be alcohol or, God forbid, drugs or gambling, right? So that addiction transfer is a real thing. It can happen, right? So that's why it is very important for our patients to go through a psychological evaluation before to identify these issues and address them. And if these issues were to pop up after surgery, we need to recognize them early and address them properly as well, right? So, for instance, if you think that there was this type of compulsive behavior, this addictive type of attitude towards food or alcohol before the surgery, you want to recognize that and address that, particularly if the person, for instance, was vulnerable to, alcoholic behavior before. That would not be a person to whom I would say, okay, you can have a little alcohol after 6 months. I would say, never come anywhere near alcohol at all because you can still fall into that trap, particularly now that we've taken food away as an option, for that compulsion. So addiction transfer essentially is a real thing that can happen whereby people who used to take care of emotional stresses through eating, now they can transfer to something like alcohol or other really very destructive behaviors.
Well, Dr. Thank you again.
Of course.
And thank you for those who are watching us live and will be watching us later on. We covered a lot of different topics today. So from the multivitamin and what vitamins do to your body, especially after surgery, and why smoking can undermine healing, and how alcohol affects your system in a new way post-op. So these are all important things. And this journey that starts with making good decisions, making right decisions, and we are there for you to make those decisions. So, until next week, take care of your body. Actually, next week we may not have a live session, but there will be something from our side. But again, take care of your body, nurture your health, and remember this journey is yours, and you are not alone in this. And until next week, stay united. Bye bye.
United. Bye.